All right, it should be working now. All right, sorry about that. Everything you guys can see them on your end?
Yes, we can
Perfect.
see. Yes.
Awesome. All right, guys, sorry about that. So we're ECU PM&R, and our PD, Dr. Clinton Falk, Associate PD, Dr. Morales, myself, Varun Goswami, and then Dr. Coker right next to me. So here's our mission for our facility. And here's a nice aerial view of Vita Medical Center located in Greenville. You can see the tall building in the back, that's our Brody School of Medicine. And we have like the main hospital and the cancer and heart tower here. So a little bit about our hospital. We're a 1,000-bed facility. We're a tertiary care center. We're the primary teaching center for Brody School of Medicine, so we get a lot of medical students. We serve a large area of North Carolina, Eastern North Carolina, serves about 1.4 million people. So get a lot of patients, a lot of referrals in. So.
Yeah. And the nice thing is at our facility, our residents, everything is pretty, like 90% of what we do is at our campus. For some of our EMGs, we do go more broadly, about half an hour away, like once a month, just so that, because some people can't have access to our facilities. And as you can see in this picture, we basically east of 95, we feed in like 29 counties to the areas. We're like the main trauma center. We see a lot of pathology. We help out a huge community within Eastern North Carolina.
Yeah, so this map shows everybody that we get fed into. So it's very, very broad. This is pretty much like some of our attendings in our class last year. And you can see that guy in the middle, he's 7'1", in case you're wondering.
Yeah, probably the tallest PM&R resident.
This is some of our faculty on the top left, Dr. Falk, that's our PD and chair now. And the bottom, Dr. Morales, that's our APD. And this is some of our support staff, very helpful. On the top left, that's Emily Haddock, that's our program coordinator, somebody that you can easily get in touch with regarding our program, and she can get in touch with us if you have any questions.
So just some of the services we provide, EMGs, sports, pain. We do a little bit of everything actually throughout the 4 years. And the nice thing is, since we don't have any fellows here at our program, we don't really compete for any procedures. We get to be first to do all the procedures in our clinics, fluoro, ultrasound, whatever it is.
We get plenty of numbers with EMGs. I mean, a lot of there's no neurology residency, so they actually consult us for a lot of their EMGs. There's no neurosurgery residency, no orthopedic surgery residency. There's no radiology residency, so we get all the interventional procedures, we get all the EMGs, we get everything. So it's really nice. Here's some pictures of our facility. So the top left is our rehab clinic, and on the bottom left we have our wound center. We're pretty big into wound. Our PD, Dr. Falk, he's wound and HPO certified, so we're pretty huge in that area. The bottom right is our VA that we go to, and then the top right is our rehab entrance to our inpatient rehab facility.
Just a little bit about our PGY years. We're a categorical program. We take 5 residents for every year. And the nice thing is, since we're categorical, the interns we get to see at the hospital, and actually the last month of their intern year is a rehab month where we were able to help them transition into the rehab role.
To the inpatient unit. The categorical program is really nice because you make like friends with all these other residents from internal medicine, from like plastic surgery, general surgery, trauma, and neurosurgery attending. So when you're in rehab, you got to consult somebody, you got to send somebody to acute, how the hospital works, who you're talking to. You can just text your buddy and be like, hey, I need some help. Come take a look at my patients. That's really nice. And our second year is more, our second year is also inpatient rehab heavy. As you can see here, we have like GR1, GR2, spinal cord, TBI, and PEDS. And just this year, we actually started to incorporate some outpatient exposure into our PGY 2 year. So with the neuro rotation, our blocks are 10 weeks long. And we do 5 weeks of inpatient neuro, and then we do 5 weeks of outpatient. So it's really nice to kind of break that up and just get some early outpatient exposure for our second years.
Then going into our third and fourth years, there's actually a lot of mix. We have a lot of clinics that we go to. There's we do 2.5 months of EMG, both in our third year and our fourth year. And there's a third and fourth year that are tag team that rotation, and they go everywhere together. Pain is in the fourth year, but you do get some pain exposure in third year also. Sports, same thing. The dedicated sports rotation is fourth year, but you do some ultrasound clinic and some sports exposure in third year also. But again, Dr. Falk, our PD, is really big in wound. So one nice thing is that if you're interested in wound, you can go for HBO, hyperbaric oxygen certification, and be an expert in wound care if that's something you're interested in too. And then a lot of bread and butter PM&R. And
pretty, some quick resident benefits. We have pretty competitive salary. I mean, for being in a smaller city with low cost of living, we're paid pretty well. So it goes a long way.
And I think the majority of our residents actually have bought property.
Yeah. Some benefits to highlight on. We get meal allowance, so about $1,200 per year, which is awesome. We get a $1,000 moving expense. Step 3 is paid for, and we're required to take it our first year. So that's all paid for. And we get a lot of money for conferences. If you get posters accepted, you pretty much get your conferences covered for the most part. So it's really nice. And then your fourth year, you get to use $1,000, whether it's for board review or for wound, the HBO certification that Naveen was talking about. And these are kind of the numbers we're talking about. I mean, these are obviously approximate. I think a lot of us get a lot more than this. Most residents get maybe about 300 EMGs total. I haven't even done my interventional pain rotation yet, and I've already gotten like 35. This is just doing like a week of pain. So
yeah, so we get a lot of exposure and a lot of numbers.
Yeah, you get plenty.
So just going into our education, we have our didactic curriculum. And where Wednesday mornings, we have protected time for education. Then once a month, we have radiology rounds where we go with the radiologist and we go through different images. We have our residents do journal club once a year, and M&M. And in our program, you have to do 2 grand round presentations. We try to get over to the anatomy lab when we can.
And do a lot of ultrasound workshops,
Yeah.
So it's really nice. A lot of hands-on.
Yeah.
We do have a mandatory fourth year medical student rotation here, which is really nice. So unfortunately, like by that point when they come, they are already decided if they're doing PM&R or not. But still, it kind of lets them know what our field does, if they're going to have any referrals to our field. And we are trying to integrate some education earlier on. So into second year, some of our residents are pretty proactive in that to getting kind of earlier education to med students.
So this is just some of the facilities we have. This is the Health Science Center. So there's a gym here. It's one of the gyms on our campus, actually. The student center too. It's right near the dental school and nursing school.
And a little allied health sciences campus. So we do try to get some volunteer work in. We do the run, walk, and roll every year. And on the bottom left, these are some of our former residents here doing the run, walk, and roll. And
this is just a breakdown of the types of patients we get or we take care of. A lot of, in North Carolina, we're part of the stroke belt. So we see a lot of neurological diseases. Being a big trauma center in our area, we see a lot of brain injury, spinal cord injury, a lot of pathology. And with that, we actually, it's not, I mean, in the past, we've had a lot of like cases accepted to conferences. So being able to travel to conferences is not really an issue for us.
We are CARF accredited. We have a total inpatient census of 55. And we have a lot of outpatient like spinal cord, TBI, have a lot of vocational services. So we do, serve a lot of Eastern North Carolina. Some highlights of our residency program: we have 100% pass rate with our recent graduates, full accreditation, no warnings or citations. You're allowed to do elective rotations as early as your third year. So if you want to do an away somewhere and kind of get exposure, you're able to. Like I talked about the numbers, there's no issues with our numbers, and we're actually the longest tenured program in North Carolina. And here's some pictures of our residency room. As you can see, like all 15 of us, the second through fourth years are all together. we each have our own workstations, dual monitors, our own little cubbies where you can kind of, with a key, you can lock away.
Yeah. We had a nice TV there. We had the fireplace on that in the winter.
In the winter,
Yeah.
and sometimes, March Madness when it's happening.
Some academic highlights. We kind of went into this before too. Grand rounds, didactics every Wednesday. Friday afternoons, we do board review. That's primarily for the 3s and 4s. We try to go to the sim lab for ultrasound education in the cadaver lab.
Mm-hmm. And it's just pictures of our inpatient rehab unit. So it's an area called New Horizons, really just working on a lot of ADLs and a lot of things to get, our patients back to their daily living. So you can see on the bottom left, they can practice card transfers. The top right's pretty cool because in North Carolina, we're pretty big with the water and boats, so they can practice boat transfers. We have our own pool, so a lot of aquatic therapy. In the middle, on the bottom, they can essentially go shopping and either work on their cognitive function and just work on their ADLs. So it's very nice.
And just some post-residency stuff. Some of our recent grads have gone into all sorts of different positions, from fellowships to directorship roles.
Mm-hmm.
A lot of people are pretty comfortable because of how many numbers we get with procedures. They're really comfortable with going straight into the field and working. But
Mm-hmm.
at the same time, we have had several people go into fellowship. I think in this graduating class, 4 of the 5 actually went into fellowship.
Mm-hmm.
1 went to peds, and 3 went into interventional spine.
Mm-hmm. And then obviously we're pretty big on resident bonding. We do tailgating, we do fantasy football, we do we actually, on the bottom left is ultimate frisbee. We just go to dinner after we took a top right is after our SAEs. We all went out to dinner and just celebrated. So it was fun.
And we were able to get tickets to the ECU football games too. So that's nice.
Free tickets. Yeah. And that's all about us. So I guess we can open the floor for questions now.
All right, guys, excellent. You have about 5 minutes and 40 seconds left. Ooh. And I will keep an eye on the chat box here if you guys have any questions. If you do, somebody has questions, and if you do have access to the chat, you can also just kind of see the questions pop up and answer at that time as well. So.
All right.
So far, nothing, but keep it coming. There you go. It's coming.
All right. So first question is, what is it like living in your area? Is it mostly suburban or urban? Yeah, so our area it's mostly suburban. I mean, we are a small town. We're about an hour and a half east of Raleigh. That's our probably nearest major airport. We're also an hour and a half away from the beach, which is nice. Probably actually an hour away from the beach. I personally, I'm born in North Carolina, so I love it here. The small town feel definitely grows on you. It takes me 5 minutes to drive to work. So, I have no excuse to ever be late. All our rotations, wherever we go, I think Wound is probably the furthest one. That's like a 10-minute drive. It's really quick. $1 goes a long way. Very low cost of living. Like Naveen said, most of our residents buy property here. So we like it.
And the only time we go far is for that EMG rotation, and the 2 residents on EMG and the attending, they actually use the hospital car and they drive out there, so you don't have to pay for gas or anything, which is nice.
Second question is, what types of research projects are going on at ECU?
So we have a lot of case studies that people write up. A lot of research, it is like, if you're interested in something, you can definitely set something up. Like one of our residents is considering sports medicine, so there's a sports medicine fellowship here through the family medicine department. So he's been working with them to get research. Dr. Norbury, one of our attendings, is very big in neuromuscular. He's put out a lot of work on ultrasound, like ultrasound of peripheral nerves, EMG, and he's very active also with the medical school and the medical students. So he is a great resource for like getting any research projects done.
The next question was, what type of environment would you say is fostered for spouses and families with the program? I think a very supportive environment. Majority of our residents have significant others. They have kids. We all try to hang out, like you saw in the pictures, with bonding, and we're all very supportive. It's in a smaller town, so we're all one big family. So I think it's a good environment.
Yeah, I think this year, like 4 of our residents are having kids or have had kids just in the last couple months.
4 residents within 4 months had a newborn.
Varun just
Myself,
had a kid. Yeah.
Got
So,
a newborn here. So if you hear some crying in the background, please ignore it.
and we help out, like if we need to cover each other or something like that. It's really,
Yeah, it's convenient.
yeah.
What's your favorite thing about your program? I think the diversity, to be honest. I mean, you get to go to wound care, you get to go to TBI clinic, you get interventional, you get ultrasound, you get your hands on everything. So you're pretty comfortable when you're an attending on managing, being a director, like a lot of our residents have done in the past. So.
Yeah, and I think one great thing that we have also is just our resident group. Everyone gets along really well.
Mm-hmm.
It's nice because our second year is mostly inpatient, so that resident room, you're there all the time. You can bounce ideas off of each other. Mm-hmm. The seniors come in and out, and they can help out when they can. So just having that camaraderie is like a really great thing within our program.
Yeah, I think so too. Is there a mentorship structure / program? I think so. I mean, you get a lot of one-on-one time with the attendings. So you get ample time to run ideas by them, run kind of your life plans by them. We every year they'll email us out to say who we want to be our mentors, and they take us to lunch, and so it's nice. It's, you know.
Hey guys, you have 1 minute and 40 seconds left.
All right, let's see.
So in our sports rotation, we are able to cover sports. You just have to talk to them, the attendings beforehand, to say what you're interested in. Right now, it's a little tricky with COVID and everything, so they're restricting the amount of doctors that go there. But normally, it's not an issue.
We actually have to do sideline coverage as a part of our sports medicine rotation. So it's minimum of 1, but you can do for all 10 weeks, up to you. So that is a part of our curriculum. The call schedule is a graduated call schedule, so heavier second year, it gets better third year, gets better fourth year. Fourth year, you have 10 call nights and 5 senior weekends. So me and Naveen are, enjoying life right now.
Yeah. The senior weekends, you can sign out at 12, so then you're not carrying a pager after that. Yeah,
your pager's on for 7 a.m. to 12 a.m. 12 noon. You run your patients, write your notes, and then the junior takes the call for the rest of the night. So it's a nice graduated call system. Cost of living, I'll be pretty open. I'm in a 3-bedroom, 2-bath house, 2.5 bath house, and I paid $150. Yeah, 2 stories. So it's awesome. Cost of living's cheap.
The higher end apartments are like $1,000 a month.
Yeah. So
yeah. Will HBO include?
Yes, I think that's still kind of being studied, whether HBO is good for brain injury patients or not. I think that's still kind of it's experimental right now. There's not a lot of good evidence based for that, but.
All right, guys. Sorry to interrupt, but time is over. What I would suggest is certainly go ahead and put your emails here in the chat box if you are okay with that. So students, if they have more questions, they can send you